Hello, everyone. My name is Nicole Hall, and I have been a registered dental hygienist for the last 11 years. Part of the reason why I chose this particular topic is that it is my passion to treat patients on a more holistic level. Since I was very limited in the dental hygiene field, I actually decided to pursue a different career in medicine to become a physician assistant. I have seen a lot of different dentists and dental professionals, and I know a great deal about the dental curriculum. And oftentimes, because dental and medical are viewed as such separate entities, the dentist will actually kind of default to the medical doctors for some decisions that could be made within the dental field, but the dentists just aren't comfortable, or they don't feel that they've had the proper training to address issues that are slipping through the cracks essentially in the dental office that could be caught and easily treated. Today's presentation is going to give you an overview of the opioid crisis and what is going on in the United States. I have a short 2-minute video that I wanted to play for you to give you a little perspective on why I chose this particular topic and how it hits home for me in the dental field.
We're back now with an urgent warning from the Surgeon General. He's sounding the alarm this week to doctors about the epidemic of opioid abuse in the U.S. And for so many teens, addiction can all begin with a dental procedure. That's something of a rite of passage. NBC News national correspondent Kate Snow explains in our new series, Hooked.
It's just primarily mom.
At just 27, Brittany Ringerson runs Lighthouse Recovery in Delray Beach, Florida. Clean for 7 years now, it's how she got here that might surprise you.
Was it a doctor who gave you your first painkiller?
It was a dentist.
A dentist?
A dentist.
Like so many teenagers, she had her wisdom teeth pulled at 16 and was sent home with a 30-day supply of Percocet.
Then came the day where I took the pills off the shelf behind the stuffed animal that I'd hid them behind and proceeded to take them.
And she quickly moved on to stronger opioids.
I learned I could smoke them. And my life forever changed.
What do you wish now, given what you know now?
I wish that the dentist would have talked more to my parents about potential consequences.
A recent study in the Journal of the American Medical Association found after a tooth extraction, 61% of 14 to 17-year-olds walked out with a prescription. Dr. Paul Moore at the University of Pittsburgh is spearheading an effort to get dentists and dental students to change how they prescribe.
We need to stop and say, now, wait.
Moore says for about half of patients, over-the-counter pain relievers are enough.
Many patients who have their wisdom teeth taken out never need or require Vicodin or Percocets or any of those opioids.
Ashley Falconberry told her dentist she was an addict, but says he insisted on giving her the opioid fentanyl last year when she had her wisdom teeth out.
And I relapsed. So was it a trigger?
Yes.
What did it feel like to have that fentanyl?
Just like a relief, like a overpowering relief.
Ashley is in recovery again at Lighthouse, but Brittany wants dentists to understand the impact they have.
I think that the dentists need to hold themselves accountable to a higher level of practice.
Dentists now trying to change so a young person's first painkiller doesn't lead to a whole lot more. Kate Snow, NBC News, Delray Beach, Florida.
As you can see, a 30-day supply of Percocet was given to the young woman depicted in the film. Clearly, changes within the dental school curriculum must happen, and prescribing practices need to be revamped. Dental students must understand that if they are willing to prescribe opioid analgesics, they must be willing to support the patients who may have the potential to abuse such drugs. Okay, so a little bit on the background. The most commonly prescribed opioids include hydrocodone and oxycodone. Opioids were intended to treat chronic illnesses that may include significant pain, such as cancer. Just like we saw in the video, the addictive qualities of the drugs alone are staggering. Because of the high that patients get, name brand prescriptions are really hot on the streets and they demand a lot more money. So pharmaceutical companies have been making great efforts to come up with generic names to help combat this issue. One of the main points I'd like to leave you with today is that both dental students and dentists must not rely on medical practitioners to catch the issues associated with opioids. Dentists have to have an action plan in place and be ready for any patient who has the potential to become another victim in this opioid crisis. Dental school curriculum needs to enforce confidence in their students and push the boundaries of current dental curriculum by becoming educated on screening, counseling, and prescribing anti-reversal drugs in the event that the patient faces an overdose. And better yet, even be willing to sit down and have a serious conversation with patients and provide some counseling. Dental curriculum should include better training and future studies on subjective dental pain, and this will help to create alternatives and help manage pain in a much better and efficient way. Collaboration within the two professions must also grow. What it boils down to is that we really need to stop viewing the medical field and the dental field as two separate professions. The next two slides that I'm going to present are pictures that can help with screening and how to approach patients if you suspect an issue with opioid abuse. This is a simple picture that you could hang in your break room or have easily available. It doesn't require you to have any major training on addiction or psychology or anything, so it's very user-friendly. These are just some things that you can keep your eye out for. In the dental field, it's very easy to look out for these things. You have your patient laid back in your chair. You can notice constricted pupils, covering their arms. You're up close and personal and could see things like needle marks. Notice that they're scratching or maybe have bad coordination. This is a chart that I made that is just a flow chart that could easily be incorporated into dental school curriculum. It's just a simple flow chart that explains how you can ask the patient permission to talk to them about potential opioid abuse. And then it just goes around, basically at the end, knowing when to refer. Does this patient need to see a pain specialist? Do they need to see an addiction counselor? Is there something that goes beyond what you can do within the dental field for this patient? Some of the challenges that I foresee is the widespread uniform curriculum changes. Contacting somebody such as the American Dental Education Association on Commission and Change Innovation is a really great place to start. They have a mission that goes really well with the opioid crisis and how we can integrate some more medical-based care within the dental field. Dental professionals need to step up and realize that they have such an important role as providers. They're not just dentists, as so many people refer to them as. They have the potential to treat patients holistically if they so choose, and this can go beyond their mouths and help combat the opioid crisis. In conclusion, I will leave you with this slide as a summary to remind you that dentists have a huge impact on the overall patient health. Dental professionals should consider a more holistic approach to patient care and not just confine themselves to the mouth. Pain management must go beyond a prescription pad. It can be counseling, knowing when to refer, and getting the patient to a medical professional if needed. I'll leave you with my recommendations and advice for fellow classmates and future students. One thing that I learned throughout this process with editing is to try out the paramedic method of proofreading your papers. It helps me immensely and to not be so long-winded. If I could redo this project, I would have interviewed current dental students and researched what they are currently being taught with so many changes in the opioid epidemic and crisis. I feel like every time I turn around, there's a new article. President Trump is addressing some of these issues and making changes with funding to help with the opioid crisis. Again, this is something that isn't going to stop anytime soon. The dental professionals must come together with the medical professionals, and I think that overall this is going to make a huge impact. And I think that it ultimately starts with a foundation, and who we need to approach more than anybody are the dental schools. And if this is taught as the foundation of care for patients and the potential for patients to abuse prescriptions that are written within the dental office, this is something that needs to be addressed. And while we might not make a huge dent in the opioid crisis, we can make a significant impact in ultimately help patients and get them to where they need to go.